Okay, I'm gonna go get your pain medication and I'll be back to administer it, okay?
Can you guys check what I was given during my last labor and delivery? I think it was called Nalbo something.
Yeah, I see here that you had Nalbuphine, or some people know it as Nubane. It's one of your orders. Would you like that medication?
Yes, that one. I know it works and I really need it.
Okay, let me get my primary care nurse and we'll be back to give it to you, okay? Hey, Hillary?
Yeah, how's our patients doing?
Well, a patient in room 412 is requesting pain medication.
Okay.
She was moaning and groaning, and when I was assessing her, she had grimacing in her face.
Okay.
She requested to be prescribed Nalbuphine, and she's had it before and knows that it works for her.
Okay.
I just wanted to clarify some things before administering it, as this is my first time giving the medication and my first time doing an IV push med.
Yeah, great. I'm just going to pull it up on the MAR so we can look at it together.
Perfect.
Do you know the indication and action of this medication?
Well, it's used for moderate to severe pain,
Mm-hmm.
and it provides analgesia during labor, sedation before surgery, and supplement anesthesia.
Yeah.
And Nalbuphine also binds to opiate receptors in the CNS.
Mm-hmm.
It alters the perception of in response to painful stimuli, and while producing generalized CNS depression.
Yeah, great. And with that being said, its therapeutic effect would be to decrease pain. Is it safe to give this medication to your patient? Any contraindications or precautions that she has to this med?
Well, I know it's contraindicated to people with hypersensitivity to the medication or bisulfites, and patients who are physically dependent on opioids and who haven't been detoxified.
Right.
There's also extra caution because people with head trauma, renal, hepatic, and pulmonary disease,
Yeah.
hypothyroidism, and alcoholism.
Yeah, that's correct. And for OB patients specifically, although this medication is used during labor, it may cause respiratory depression in the newborn. For breastfeeding mothers, it can cause respiratory depression and excessive sedation in the infant. For geriatrics, a lower dose is suggested, and there isn't any safety set up for pediatrics yet.
Are there any interactions for this medication with others, or any natural products that shouldn't be taken with it?
Extreme caution in patients taking MAOIs because they can have a severe unpredictable reaction. Patients taking this medication should also refrain from other CNS depressants, which could cause a profound sedation, respiratory depression, coma, or death. Using kava kava, valerian, chamomile should also be refrained, as these can cause an increased CNS depression. Okay, now tell me the ways in which you can administer this medication. What will you assess and educate your patient on?
Nalbuphine can be given IM, subcutaneous, or IV.
Mm-hmm.
For IM, you should always rotate the injection sites.
Correct.
But I'm going to be giving my patient through IV push because she's in severe pain,
Mm-hmm.
and the onset is 2 to 3 minutes.
Mm-hmm.
It peaks in 30 minutes and lasts 3 to 6 hours. You can give this medication undiluted, a concentration of 10 to 20 milligrams per milliliter at a slow rate, each 10 milligrams over 3 to 5 minutes.
Yeah, that's right. And what would you give your patient in case of a Nalbuphine overdose?
Naloxone for sure.
What are you going to educate your patient on with this medication?
To change position slowly because it could cause a dizziness and drop in their blood pressure.
Orthostatic hypotension. Mm-hmm.
Avoid use of alcohol with this medication as well as other CNS depressants. And that they shouldn't drive because of the drowsiness and dizziness that it may cause.
Yeah, and you want to make sure that you go back and check in several minutes to assess their pain level. The goal of this medication is to decrease the severity of pain without significant alteration in their level of consciousness or respirations, which is why close monitoring is critical. Do you feel ready to give that medication?
Yeah, thanks for your help.
Yeah.
Talk to your doctor to see if Nalbuphine is right for you in your next labor.